Hello, my name is Elena DiChiara. It is March 31st, 2021, and I'm going to be talking about surface anatomy with the help of my lovely assistant, Andrew Brandon, my willing participant. Okay, so we're going to do the skeletal system around the head and a bit on the neck, or at least 5 parts of it. So this is the supraorbital margin, this is the zygomatic bone, this is the body of the mandible, and we're able to trace down from the mentalis here, that muscle, to the first hard surface. It's easier on a male because it's their Adam's apple, otherwise known as the thyroid cartilage. And then if we trace further down, we have the cricoid cartilage. And first, I want to mention the clinical significance of the thyroid and the cricoid cartilage. Both of them guard the entrance to the trachea. They protect the glottis, which prevents aspiration. They also provide key attachments for muscles in your neck, and also they're a critical part of vocalization, of producing sound. So I want to mention that first. But in terms of surface anatomy, what they're really important for is actually being able to locate the thyroid gland. So if you trace down from the cricoid cartilage, you can actually start to feel the rings of the trachea. And if you put your hands flat, kind of like you're choking the patient here, you're able to feel where the thyroid glands are. Usually you'd have the patient swallow and you'd be able to feel if one is moving differently than the other. You can feel if there's swelling, if there's a goiter, which means that there could be an iodine imbalance. You can feel if there's any cysts or nodes happening in the thyroid glands. And this is all critical. You could be looking for Graves' disease as well. A bunch could be wrong with this very, very important endocrine gland, the thyroid gland. And we're able to just tell because of that palpation and because of that surface anatomy test. Also, the general importance of surface anatomy has to do with whenever you get a patient, they come in to your office, your hospital, and you give them a physical exam. And before imaging, that's how you know what is wrong with them. You're able to see, hear via auscultation, and also what you can feel by palpation. And for example, when you do the abdomen, a normal exam is non non-tender, soft, no rebound, or guarding. And the way you know that is by being able to touch everything. And by you can only know that everything is okay by you would see an abnormal sign and you would feel an abnormal sign. And it's important to know what normal is like before you can know abnormal signs. Like Murphy's sign, again, for instance, that's something you can know in the abdomen that will give you a clue to what's going on. And that's critical for your next steps in patient care, in diagnosis, and in treatment, and in your medical plan. So this has been my video on surface anatomy. Thank you so much for watching. Thank you, Andrew, and goodbye.